episode 61 of the Real World Wellness Podcast. Listeners, I don't know if you caught that little name change from Real World Paleo to Real World Wellness, but I think wellness now reflects more accurately the breadth and diversity of topics that I cover during the podcast. So just look for the new title, Real World Wellness, and continue to listen. Thanks. Hi everyone, I'm Kristins Lehman, a nutritional therapy practitioner and reverse diabetes coach, which is also the name of my website. I help clients reverse diabetes naturally, lose weight, and lower their cholesterol. I also see clients by Skype. You can buy some great paleo and primal products on my podcast page, such as Primal Life Organics and grass-fed meat. I switched to Primal Life, which is completely natural and organic skincare this year after interviewing Primal Life CEO and nurse Trina Felber here on the podcast about some common chemicals found in many skincare and hair products. I love Primal Life face wash and other products, which you can check out on my podcast page, again at reversediabetescoach.com. Please remember while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. I want to welcome Dolma Johannesson to the show today. Dolma is a licensed and practicing acupuncturist working as a member of the Holistic Family Medicine Group, located in 2 locations, Frederick and Laurel, Maryland. She also serves as a faculty member and student clinic supervisor at the Maryland University of Integrative Health, formerly known as Thai Sophia Institute. Since graduating from high school in 1983, Dolma has obtained a bachelor's degree, 2 master's degrees, and attended 2 Army colleges. So very well educated. Dolma has served in the United States military for 21 years. And thank you for your service. She currently speaks publicly regarding the many benefits of whole body wellness. Raised on a farm most of her childhood, Dolma grew up learning the value of good food and holistic medicine. She is a family member of 6 generations of a farming heritage with grandparents and great-grandparents well-versed in herbal remedies and holistic care. Dolma is a strong supporter and advocate of sustainable farming and promotes green energy. Originally from the Nashville, Tennessee area, she has lived in many different areas of the country and abroad, earning several military medals and certificates of excellence. She understands the value of hard work, sound ethics, and good leadership. So welcome, Dolma.
Thank you, Kristins. I'm happy to be here today.
Yes, I'm really excited to delve into acupuncture. And I wondered if you could just give us a little bit of history, if you will, about your journey and what got you interested in this, and maybe explain a little bit about your training as well.
Okay, sure. Like many of my colleagues, I started in the acupuncture field as a patient, having unexplained and excruciating back pain the last 2 to 3 years of my military career. There was no explanation that could be given to me through Western medicine. Becoming very frustrated with that diagnosis, I finally, at the encouragement of friends, to go and see an acupuncturist. And within about 3 treatments, my back pain had not only disappeared, but I felt the best I had felt in a really long time. Not just physically, but mentally and emotionally as well. Mm-hmm. I was really just taken back by how much better I'd felt, most especially to be pain-free for the first time in at least 2 years at that time. I decided that I really wanted to pursue a career in acupuncture after retiring from the Army, and wanted to help people in the way that I had been helped. So that's what got me into acupuncture. After I retired, I went to school. At that time, it was Thai Sophia Institute, entered their master's program for acupuncture, and 3.5 years later, became a licensed acupuncturist and started my private practice.
Mm-hmm. Well, it sounds really fascinating. Can you maybe explain a little bit about the training? And I always picture needles when I think of acupuncture. And so maybe you can tie that in, what is sort of just a basic overview.
Sure. Acupuncture is a system of medicine, if you will, that has been helping people for almost 5,000 years at this point. A lot of people don't know that it's been around for that length of time. And I have to add real quick that I always find it comical when people say, no, I actually prefer traditional medicine when acupuncture is actually traditional medicine as opposed to Western medicine. But at any rate, yes, there are over 300 points on the body. And we say needles, but in reality, they're more like pins. They're very small. You can find them on the internet. There's tons and tons of images to give you an idea of what an actual acupuncture needle looks like. And they come in a lot of different sizes in terms of diameter and length. And based on the point on the body, the physical location and biology of the body helps dictate to the acupuncturist what size needle may be needed for what condition is being treated. There's also points on the ears, all over the body, the head, of course the limbs and extremities. There are 12 main or primary meridians that most of us practitioners focus on. But one way you can think about the energetic body is a web of energetic channels. So there really is no known amount of channels that are in the body. I've heard everything from 8 to 84,000. And so I think it depends on what lineage of acupuncture you practice, what your personal philosophy is, on what your answer to that might be. For me, I see the body as a web of energetic channels, and I can access those energetic channels through 12 main or primary energetic channels and 8 more deep energetic channels. And I have found in my clinical practice, which has been about 8 years now, that I can attend to pretty much any condition, syndrome, diagnoses, disease, syndrome, etc., through this particular web or network of energetic channels.
So we were talking about where did acupuncture originate. I tend to think of China, but I'm not sure that's completely accurate.
That's true, Kristine. Most people give acupuncture the credit to its origination to China, but the reality is acupuncture is probably 5,000 years old at this point, and it originated all across Asia and parts of what we refer to as Eastern Europe today. So while Chinese medicine has become somewhat of a label, it's not entirely accurate. I know for myself and many of my colleagues often refer to it as Asian medicine because at the same time that the great Chinese masters were discovering the meridians and the flow of qi and the meridians and the point system, they were making these discoveries in Korea, and Thailand, and Japan, and these other Asian countries as well. The Himalayan region of China, the Eastern European countries of today, which was obviously marked a little bit different in that time. But all across that region, acupuncture, what we have now referred to as acupuncture, was originating.
Mm-hmm. Yeah, that is so fascinating. And I think you were saying you think of it more as Asian?
Right. I think of it more as Asian medicine. The exact title is acupuncture, or I guess you could say that the umbrella that a lot of the educational systems will refer to it as Oriental medicine. But it's because it is trying to give credit to, this is not just from China. This is actually a medicine that is predominantly Asian. But again, we've also been able to trace back, and there's literature and study that will show that it goes from what is now today Eastern Europe all across that geographic area to the Pacific Ocean.
Mm-hmm.
So medicine around the model of meridians and qi and the point system was originating in that entire, which is a very large geographic region, pretty much all at the same time. I think my theory is that somewhere along the line it got labeled as quote-unquote Chinese medicine, and I'm curious about if that happened because the Chinese were a lot better about documenting and putting it into language and teaching it and putting it more out there than other cultures and traditions. And so I'm curious if because of that it became more of quote-unquote Chinese medicine. But now with today's ability to do further research and you find there are other modalities that actually came from, say, Japan or Korea. They have their own styles of acupuncture and a very long and rich tradition in those countries around acupuncture, or the meridian system with points and the flow of qi within those points and meridian systems. So, in fact, the modality that I practice has a heritage rooted more in Japanese style than it does Chinese style, or the European style as opposed to the Chinese style. It's not to say that I'm exclusive, but the styles that I have been trained in and prefer actually date back to lineages that come more out of Japan and Eastern Europe than China.
That is so interesting. Just very quickly, what is the difference between Japanese in terms of your actual practice? Is there a noticeable difference?
I think so. It's mainly style. It's style. It can also be the point system itself. While most of the point systems are very similar, there are some subtle differences based on the anatomy of the body. So, for example, one style may have a particular kidney point above the malleolus, and then the other style may have it just literally a millimeter below that. So the differences are very subtle, but they are there. Mm-hmm. The theory or the philosophy behind the approach to the medicine, there are some subtle differences in that. How many needles are used, various protocols. Acupuncture is a vast medicine. There are over 300 points on the body. So if you think about the body as an energetic web, or I should say a web of energetic channels, you can get an idea of, and then you put human beings in that, where there's going to be differences of opinion and differences of philosophy and differences in ways of being and dancing with light. That will come through in the various lineages of the medicine. So while generally speaking, acupuncture is essentially the same across the board, once you get into the various lineages of it, there are some subtle differences. And I don't think one is necessarily better than the other. I think it's more of what does the practitioner feel most comfortable with, what style or lineage or modality most resonates with the practitioner. There are certain pieces about traditional Chinese medicine I really appreciate for very specific things. And then on the other hand, there are there are certain protocols and practices within Japanese style and lineage that I appreciate just as much for other kinds of things. So it's really about a well-rounded acupuncturist will not be intimidated by pursuing or at least studying the subtle differences and being willing to say, oh, this particular style might work best for this particular patient given these conditions. And I think it keeps the acupuncturist on their toes, quite frankly, because it's important to not get complacent in your work.
Yes, absolutely. So I know you think of yourself more as a generalist, but at the same time there's certain conditions or areas of specialty that you also have. So can you kind of explain how your philosophy and balancing of those two things are?
Yeah, sure. I'd be happy to. I do consider myself more of a general practitioner because I don't want to say no to anything. I will. There's nothing I won't at least attempt to treat or help a person with. Over the years that I've been in private practice, I have found myself moving more into some areas that I would say, yes, have become somewhat specialties of mine. One is around fertility. When I first started out in private practice, I really didn't have the intention of, I'm going to become a specialist in women's health. It kind of naturally happened where I ended up helping a number of women who were having issues around getting pregnant, where I've now helped a number of families have children. And it's very rewarding, and it's always fascinating and fun to work with helping people become pregnant and seeing them through their pregnancies and helping them have healthy pregnancies. And it's really wonderful to know that the fetus is also receiving that acupuncture just like the mom is. And I have seen it over and over now in my clinical practice, the difference in babies who have been in the womb when the mother has received acupuncture as opposed to the alternative. And with the children that I have been able to help with, their mothers and fathers both report to me he or she is so calm and sleeps through the night and is a good eater and all these kinds of things, not really sick. And so I do think it makes a difference, a huge difference. I'm like, wow, if you can receive acupuncture before you're even born, how great is that? So the other areas that I tend to specialize in also include pain. I see a lot of patients for either acute pain or pain management. And again, that's something that has somewhat evolved. It just has shown up in my practice, and so I've put some more focus and education into understanding how pain is in the body, how different people experience pain. How I treat my pain patients is never the same. It's not one shoe fits all. It really depends on the person, their level of pain, what kind of pain is it, and the root cause of the pain. And I am in this medicine and in this field large in part because I want to lessen the suffering of beings as much as I can. To be able to do whatever I can to help lessen that suffering is the main and principal reason why I'm in the field in the first place. And so when a person comes to me and they're in, 8 or above pain, which is generally considered excruciating, I want to do whatever I can to lessen that pain as much as possible. I do, there are some conditions where pain doesn't go away, it's managed, and there's a difference. And a lot of my regular patients that come to me for pain, that's what I do, is I help them manage their pain to a degree where if they see me, they don't have to take a lot of pharmaceuticals, and in some cases they don't have to take pharmaceuticals at all. As long as they stay in a regular treatment plan and protocol, I am able to help them manage pain that would otherwise be a 6 or above to keep it to around a 1 or 2 or 3, with even periods of times where they have no pain. And so the idea is if you can manage that in a holistic approach, it's better on your body because you're not putting a lot of medications into your system, or then your kidney and your liver and your spleen all have to process that.
Mm-hmm.
I guess the third area or the third specialty of mine, I would call more of a spirit nature, and that is helping individuals achieve their highest potential, whatever that is. And I say that's more of a spiritual nature because the philosophy that I carry with me is that all beings are within what I call 3 realms of existence, meaning they have the physical body, which carries them around and helps them do day-to-day activities, the emotional or mental body that is encapsulated within the physical body, and then the spirit body, which is not to be confused with a particular religion or faith, but the spirit of the person, and there is an entire spirit body to all of us. And that spirit body has to be thriving and healthy and glowing and content and evolving in order for the other 2 bodies to be healthy and happy and pain-free or disease-free, etc. So I have, over the years, found one of my great loves in this medicine to treat the spirit body in individuals not only at the same time that I may be treating the physical or the emotional body, but sometimes that exclusively depending on the individual. I'll give you an example of that. I had a patient just yesterday who seemingly is healthy, no apparent diagnoses of conditions or any of that, a few aches and pains because of the age group, but by and large doing really well, and coming to me for acupuncture to have a more fulfilled life or a more fulfilled connection with themselves deep inside. And most people don't actually know how to articulate that. They know there's something in them. They know that they are a spiritual person, but they've lost their way and how to connect with that. And this is one of the great loves of my work, is to help individuals make that connection back to that spirit part of them. When the spirit body begins to die or be repressed or suffocated, it's only a matter of time before the emotional and the physical body begin to deteriorate. It's actually that spirit within us, and you can see it in people's eyes. So when you make a connection with a person and you're really pulled in by their eyes, so to speak, that's actually the spirit body you're connecting with. And so the spirit shines through the eyes. It comes from the heart and it shines through the eyes. And when that spirit becomes demeaned in some way or repressed or oppressed or suffocated, whatever word you want to give it, then the spirit begins to go in and that glow of us begins to dim. And then it's only a matter of time, like I said, that emotional, mental, physical symptoms begin to arise. And so my thought is, okay, if they're not in excruciating pain, which I always have to and must deal with first, if they're doing seemingly well, but they know that dim of them, that glow of them is small, and they won't even actually a lot of times have the words to articulate it, I can use this wonderful thing called acupuncture to ignite and facilitate that spirit body coming to life again and shining out of the heart and through the eyes. That can take a little time. Mm-hmm. That's not something that happens in 2 or 3 treatments, but over time that begins to happen, and my patients will tell you, like, I don't know what Dolma does, I just know that when I leave there, I feel connected again. I feel like I know where I start and where I end and where another person starts and ends. And I know how my energy impacts those in my family, those in my immediate circle. I have changed. And that's what we call evolution. That's spiritual evolution within the context of a person evolving to their highest potential. And I love doing that work.
Oh, I can understand. It sounds like they become more integrated.
Exactly.
That is so
right.
cool.
Those three bodies become more integrated to operate as a unit.
Mhm. And that's really what holistic medicine is about, right?
That's right. Exactly.
So I was wondering if you could tell us a little bit about herbs that you use in your treatment.
I do incorporate herbs with several of my patients. If it's not too complicated of a case, I can manage that, and I'll script the herbs. What I think the herbs, there's different herbs is its own medicine. A lot of people probably don't realize that, but herbal medicine is its own modality. It's actually older than acupuncture because there were plants first, which sounds kind of silly, like yes, of course, but so herbal medicine is actually the older medicine. And physicians, also known as acupuncturists, they were referred to as physicians in ancient times, would prescribe herbs for different ailments, conditions, etc. And it's been on the planet long enough where it's finally gaining some. I think we had it, like there was a time, because my grandparents, my grandmother specifically, was an herbalist. Mm-hmm. She didn't necessarily call herself an herbalist, but she had this knowledge base of plants and plant life and plant systems and how to put certain plants together and actually make a formula. And as a kid growing up, we always called it Granny's potions, but you know, as a fun thing to do. But basically, she had just an immeasurable knowledge base of plants and plant life and plant systems and how to put those together for medicine. If I have a more complicated case, I may refer the patient to someone who specializes in herbs. Herbal medicine is their modality. Mm-hmm. The less complicated cases, I feel confident in my own practice to script. But I know a number of really wonderful herbalists. That's what they do. That's their specialty. And I have, I really want what is best for the patient. And so sometimes I will refer them, like, what you really need is a good herbal formula. I'd like you to go see this person.
Right. I think you mentioned using the herb mugwort, and there's a process.
Yes.
Mm-hmm. Called Moxibustion. I don't know if I'm pronouncing it correctly.
It's mugwort is an herb that acupuncturists use that goes through a process and becomes what we call moxa. Moxibustion is a modality somewhat all on its own that is 99% of the time incorporated into what acupuncturists do. And so essentially what it is an herb that goes through a process to be put in a form that can be molded into small cones or large cones, or there's all different kinds of moxa, all different shapes, sizes, degrees of potency, etc. And it's either placed on the body, or it's placed on the needle, or placed in what we call a box to be used essentially like a heating pad, a modern day heating pad. And the idea behind using Moxibustion is what it does is it brings the body fluids, most especially blood, and chi, or energy, in the body together. And when you do that, it is primarily used to relieve or disperse what we refer to as stagnation. The patient knows it as pain. So it can be a stabbing pain or a dull pain, but they experience it in the body as some type of discomfort. And practitioners, acupuncturists, will use moxa in a particular area, or like I said, on a particular needle place, very specifically on the body, to bring blood and qi together, and then to increase circulation, to reduce pain, to increase the flow of qi in the body, and by doing so, the patient experiences pain relief because it's moving that stagnation out. I like to use the analogy of a water hose. So you know when you have a water hose, water's flowing through it, and then you tie it in a knot or you bend it over, it cuts the flow of the water. There might be some a little bit of water still coming out of the hose, but most people know what I'm talking about when I use this analogy. And then when you let go of the hose, the water will burst out quickly, and then it goes back to a normal flow. That's essentially how qi flows in the body. And so when it can become stuck or stagnant in certain areas of the body. And so the acupuncturist is going in with needles and moxa to essentially open that channel back up to allow that flow, and they can experience it on the table as a lot of patients will experience that initial burst of qi through the area, and then it will begin to calm, and then they're like, oh, that feels better. Oh my gosh, that feels so much better. And that's what we're doing through needles and moxa, is releasing that hose so that the water can flow.
That is so interesting. And I like your analogy. I know you have some case studies also to share that kind of illustrate how you work with patients or clients and some of the conditions we've been discussing.
I do. It's hard to pick because I have so many fascinating patients, and some of my greatest learnings have come from my patients, and I'm very grateful. I'm very grateful for the patients that have shown up in my career so far, and look forward to my future patients because the greatest learning really comes from them. I'm thinking of 3 patients in your question that kind of come to mind, very different situations, all yet unique and interesting. One that comes to mind is my patient who came to me with a diagnosis of kidney disease almost 2 years ago at this point, and a very serious condition. Her kidney was operating at less than 10% when she came to me.
Mm-hmm.
And so I immediately began treatment with her. I became a member of her treatment team, or what she would refer to as her medical team, and I was very much an active member of that team, just as much as her doctors and other individuals on her team. And the thing I like to share is that through the medicine of acupuncture and moxa, I was able to keep her off of dialysis. And this is really not only a physical component, but an emotional component, because for her to be able to continue most of her daily functions, she did have to take a leave of absence from her job, but for her to be able to continue to be independent and not rely on a dialysis machine or dialysis and the various forms that can take place was huge for her, not only physically but emotionally. And her doctors were just as shocked. They were, keep doing the acupuncture, because they could see the difference in her in comparison to their other patients that were at similar levels of functioning and were already on dialysis or needed dialysis. Mm-hmm. And I think that speaks to the medicine. I don't necessarily think that was me specifically. I think that speaks to what this medicine can offer. Now, acupuncture, I can't, she still needed a kidney transplant, which she did finally receive a year after she came to me. She finally received her kidney, but what I was able to do is complement the work of what was happening over on the Western end, and the benefits of that can be not only for obviously the patient, but if you think about it, it actually benefits Western medicine as well, in that look at the cost savings that were involved in this patient not having to have dialysis.
Right.
And that's like a whole nother conversation that I won't delve into, but I do like to take the opportunity to mention it, that I think it's also a good example of how Eastern and Western medicines can work together for the benefit of the patient. Another case is, and more common, is fertility cases. Like I mentioned before, I've helped a number of couples with having children, and this one case comes to mind, in that her issue wasn't so much in getting pregnant, but was sustaining pregnancies. When she came to me, she had several miscarriages already and was really wanting to have a child. It was very important to her to have a child. She was open to the idea of adoption, but really was kind of sad on having a child of her own, which is very common. And my approach to her was similar than I had with my other fertility patients, but a little different, because the issue wasn't so much in helping her get pregnant, but it was in helping her sustain a pregnancy. And that was a great learning for me. We were successful. She delivered a very healthy baby boy that I actually saw just last night, and he's just the cutest thing ever. And very healthy. She was able to get through the pregnancy with very minimal complications. She was considered a high-risk pregnancy by her doctors. And she would tell you that she gives full credit to the acupuncture she received, and also the coaching along the way to help her maintain herself in a way that her baby could receive optimal nutrition. And again, he received the acupuncture at the same time she did when I would treat her. And I always, when I'm working with pregnant patients, I always talk to the baby too. I don't approach the mother where it's just the mother. I always approach them. I talk to the baby that's inside. I talk to the fetus. I touch the stomach. I needle the stomach. I treat the mom as though I'm treating the baby at the same time as the mom. That's a perspective and a philosophy that I hold. This case was really unique in that, I'll be honest and say, I was concerned. I couldn't promise this lady that I could help her sustain pregnancy. I could only promise that my intention would be pure, and I would do the best that I could to help her sustain the pregnancy. And we were successful.
Yeah, that's amazing, because she had a history of miscarriages.
She did have a history of miscarriages, correct.
Mm-hmm.
I have since seen another woman who has a history of ectopic pregnancies, and so, and she just delivered a baby girl, and as far as I know, they are doing fine. I haven't actually seen her yet. She was just born. But a similar situation in that high risk, a history of complications around pregnancy, and I think acupuncture, it's becoming more understood among Western medicine modalities in fertility. I think acupuncture is gaining some credibility. There's been too many cases to ignore at this point. Mm-hmm. That indicate how beneficial acupuncture can be in fertility cases.
One thing I would wonder about a little bit if I were pregnant and coming to see you is it safe to put those pins, and I know you were saying they're more like, the needles are more like pins, to put that on a woman's stomach when she's pregnant. Can you address that?
Oh, absolutely. think of needles, a lot of us think of like a hypodermic needle because that's what we're used to growing up with immunizations or when you have to go to the doctor and get a shot for this or that. But in acupuncture, we say needles, but they're really not needles. They're more like pens. They're solid, so nothing's going in and nothing's coming out. And honestly, they go in so superficial to the body. It's not, when I put needles in the stomach of a woman who's pregnant, they're not, it's superficial because chi in the body, energy in the body, is not just in the core of us. It actually goes all the way out to the skin and actually even hovers above skin level. So the pens don't necessarily have to go that far in to address issues around chi or imbalances in chi or imbalances in energy. So it's completely safe to place the needles along the midline or to the side, whatever it is that we're trying to do for the patient, and whether they're pregnant or not. And I will say, that there are certain points on the body we do not do through the various trimesters because we would not want to influence the baby being born prematurely. So there are what's called forbidden points during each phase of pregnancy.
Mm-hmm.
But there are a whole host of other points that we can do to facilitate the health and vitality and wellness of the mother through the course of pregnancy.
Mm-hmm. Yes. Thank you. And you also mentioned you had a patient with Parkinson's disease.
Yes, I've had a number of patients that have come to me. The one patient specifically I'd like to mention, she came to me several years ago when she first got the diagnosis. She had a small tremor, has a small tremor in her left hand. It started out like in the pinky and fourth finger area and kind of went up to the wrist, not really past the forearm. And it was something that she noticed in herself and was immediately, smart enough to immediately go to the doctor and have it checked out. Was in her 60s at the time, and yes, received a diagnosis of what we call Parkinson's. And she came to me. She'd never been to acupuncture before, but she'd read a lot about it. She was a fan of holistic medicine and the holistic approach, and she knew that she wanted to, in addition to what she would need to do with her Western team, she wanted to incorporate acupuncture into that. And long story short, what I've been able to offer to her over the years, she does continue to come to see me every 2 or 3 weeks at this point. In the beginning, it was more. But like my patient with the kidney transplant, I'm a member of her medical team, so to speak. And over the 6 years now that she's had Parkinson's, the tremor never went past the elbow. So she still only has that small tremor in the left arm. She's just recently began to have what we call the Parkinson shuffle, which means the gait of the individual changes. It becomes more difficult for them to lift their feet and walk like, I'm hesitant to use the word normal, but like most of us, how we walk, when you have Parkinson's, that gait begins to change and deteriorate. And she's still moving about, still very independent, still lives on her own and runs her horse farm and is able to do all the things that she enjoys doing, albeit it is getting harder, but she would tell you that she doesn't know if that's because of the Parkinson's or that she's now in her 70s.
Yeah, I was just going to say, she's
it could
getting
also
up there.
be age-related in terms of she does get more tired and whatnot. But the thing I really want to say is, and her doctors would say this too, is that one of the greatest benefits that I've been able to offer this particular patient with Parkinson's is not only managing the physical symptoms and pushing them back, so to speak, so that they don't manifest in the way that they do with other patients who have had this disease for the same amount of time, is the emotional stability that I've been able to offer this patient, because I've been able, through the medicine of acupuncture, to subdue the symptoms that come with Parkinson's. That has brought tremendous emotional health to her, to be able to stay independent. She did retire from her job, but to be able to give her an independent life of being on her farm and doing her gardening and continuing to have these things that bring her a lot of joy has done a tremendous amount to her emotional health. And also cognition. She just recently, that's another thing about Parkinson's, which is horrible to watch, is a breakdown in cognitive ability. It is a neurological disease, so it makes sense that there would be breakdown in cognition. And she just recently had her annual cognition test. I think she actually gets it a little more often than annually. And she was at 100%, and her doctors are blown away by that. They're like, you've had Parkinson's for 6 years, and your cognition has not declined any.
That's amazing.
And whatever you're doing, keep doing it. And she tells everybody, I get acupuncture, I see Dolma every 2 weeks. You know, she gives full credit to the acupuncture and her ability to have the life that she has. Does she show signs of Parkinson's? Like, when you see her in the grocery aisle, can you tell that perhaps she has something? Yes, you can, because she does have a little bit of the tremor, she does have a little bit of the shuffle, but by and large, she is an independent woman.
Mm-hmm. It sounds like you've really slowed the progression down.
Yes. The acupuncture has. I always give credit to the medicine. I'm just the facilitator of it.
Mm-hmm.
But yes, it has slowed the progression down tremendously.
Mm-hmm. And I hope that gets more credit and more research, so people can understand, more about what is going on there and give it more credibility. That would just be fabulous.
I think it would be too. Not just, in all these things, and acupuncture is difficult to measure because its greatest strength is in preventive medicine, which is very difficult to measure. And I leave that up to the researchers and the scientists and those that, I'm a clinician, and I see myself as a clinician more than a researcher or even an academic. I'm a clinician. I'm like boots on the ground, and I can see what it's doing, and I'm getting enough years under my belt where I feel confident in saying, I know it can do this, I know it can do that. But I agree. I do hope that my colleagues are able to work with the folks at, say, at NIH and the Mayo Clinic and these other institutions to help bring more and more awareness to the benefits of acupuncture, which in my mind are immeasurable regardless of the disease or the syndrome or the condition.
Mm-hmm. So that's a nice segue into what should people look for in an acupuncturist.
Well, first and foremost, you want to make sure they're licensed in the state that they're practicing. If they hold a license, they have met all of the qualifications to be an acupuncturist. So I always tell people, make sure that whoever you're seeing, that they're licensed in the state they're practicing. And then secondly, and I think is just as important, is to have resonance with your practitioner. It's important in order for the work to happen in the treatment room. The patient needs to feel comfortable with the practitioner. A lot of people see doctors and they'll tell you, I don't really like the doctor, but I go to him or her because they have good reviews, and they're supposed to be a specialty in this area, etc. But I don't really like them. And I think in acupuncture, I would say you want to like your practitioner. You want to have a resonance with that person. You want to feel comfortable with them. You're going to be sharing private information about yourself and your medical history. It's important that you feel comfortable with them, that you're at ease. If you do have a question, don't hesitate to ask your practitioner, what are your thoughts about this, or how do you treat that, or can you show me what the needles look like? Can you show me how they work? I've never had acupuncture before. Don't be afraid to ask those kinds of questions. And a good practitioner will take the time to explain how it works. They'll take the time to explain how energy works in the body and how we're made up as energetic beings. They'll take the time to be with you and explain those things, because it is a partnership in the treatment room. It's not yes, one person is practitioner and one person is patient, but in order for healing to really happen, a partnership has to be there, and that partnership happens through resonance and trust and being comfortable with your practitioner. Acupuncturists are held to a code of ethics. They're held to boards of acupuncture all across the nation. They're held to the same degree of responsibility as other healthcare individuals, physicians, physician assistants, nurses, etc., psychologists, psychiatrists. Acupuncturists are held to these same levels of degree in terms of code of ethics. And so when you meet with your practitioner, A, first and foremost, make sure they're licensed in the state of which they're practicing, and B, do not hesitate to ask questions that you have concerns around. Do not be afraid to make sure you ask the questions you need to ask in order to feel comfortable with your practitioner.
Mm-hmm. Yeah, that's an excellent point. And we talked briefly about health insurance. Can you just say whether health insurance or whether you participate in any health insurance networks?
My first response to that is it's a ever fluid, ever changing situation in the field of acupuncture. In terms of insurance right now, it has changed tremendously just in the last 5 years of how it works. More and more healthcare providers are adding acupuncture to their various plans. Some are with very specific conditions. Others are more broad in their terms of what's accepted through insurance and what isn't. And it's constantly changing. What I tell you today is happening in the insurance world as it relates to acupuncture could be different tomorrow. It's constantly evolving, and essentially, the way I like to put it is they're still working on getting all the kinks worked out of that system. Right now, I am not in a network. I do see patients that are able to be reimbursed for acupuncture through their various plans. Mm-hmm. I do work with a number of healthcare providers, and I provide the patient with the proper documentation that they need to receive the benefits from their healthcare provider.
Right.
It's different from patient to patient because they all have different healthcare providers and plans within the context of that. So it really has been a challenge. I don't want to indicate it hasn't been a challenge, but I've been very willing to do what I can to work with these patients because I absolutely want them to reap the benefits of acupuncture, and if they can get reimbursed for it, then yes, most definitely. Let's give them what they need in terms of documentation, so you can stay in treatment.
Absolutely, and I totally agree with you. It varies by plan, and it's best for people to just check with their specific insurance plan.
Exactly. Read the fine print. What's covered, what's not.
So, Dolma, where can people find you?
People can find me either in Frederick, or I also see patients at Maryland University of Integrative Health, which is located in Laurel. My main practice is holistic family medicine located in Frederick, Maryland, and my website is acupuncturehelpsyou.com. So the addresses, phone numbers, etc., all on my website. You can contact me through the website or through my email, which is D and my last name, Johannesson, @gmail. And all of those emails and phone numbers are on my website. So I look forward to hearing from any of your viewers that are more interested in acupuncture, and feel free to contact me through the website.
Well, that's great. And I will also include your contact information in the show notes. And I want to thank you so much for being on the podcast today, Dolma.
Thank you.
So listeners, don't forget you can still get 10% off the wonderful extra virgin olive oil products from Casandrinos International on their website using the coupon code RWP. Again, that's RWP. Next episode, my friend and certified nutritionist Amy Berger and I will talk about how you can prevent, detect, and treat diabetes naturally. Thanks everyone, and be well.